February is Heart Month, and today I'm going to be talking to you about one of the most common cardiovascular diseases, heart failure. Heart failure describes a condition where the heart fails to either pump blood to the body organs, known as systolic heart failure, and/or fails to relax and empty the blood coming from the organs back to the heart, known as diastolic heart failure. Patients can have one of these kinds of heart failure or both. It is estimated that 26 million people worldwide suffer from heart failure. It's a major cause of morbidity and mortality, especially in the older population. Heart failure symptoms could include shortness of breath, especially when exercising or lying flat, edema, which is mainly in the legs, fatigue, weight gain, cough, cognitive changes, and even chest pain. And there are other symptoms. Heart failure symptom severity is graded according to the New York Heart Failure Association classification, which goes classes 1 to 4, and the higher the class, the worse the long-term prognosis. Classifying heart failure can be confusing, but a recent universal definition is worth mentioning. Heart failure stages are now classified as at risk of heart failure, pre-heart failure, and advanced heart failure. According to the ejection fraction, which reflects the strength of the heart or the heart function, heart failure can also be classified as heart failure with reduced ejection fraction, less than 40%, heart failure with mildly reduced ejection fraction, that's between 40 and 50%, and preserved ejection fraction, which is greater than 50%. The new definition also includes an improved ejection fraction category, which is defined as an improvement of ejection fraction by 10% or more from baseline. These definitions are important as they determine prognosis and treatment strategies. So what causes heart failure? Hypertension, coronary artery disease, valvular heart disease, diabetes, advanced kidney disease, and heart rhythm disturbances are some of the common causes. Now, infiltrative, familial, and hypertrophic cardiomyopathies are also causes of heart failure, but they're less common. Diagnosing heart failure usually starts with a good history and physical exam. Physical exam findings include signs of congestion, such as bilateral pitting edema, lung crackles, and an elevated jugular venous pressure. Other signs on physical exam, such as cold extremities, reduced capillary filling time, altered mental status, and low blood pressure, are signs of reduced cardiac output, which can lead to multi-organ failure. It is very important to recognize these constellation of findings because they warrant emergent treatment. Now, blood tests such as comprehensive metabolic panel can help determine if heart failure has caused organ damage. Other blood tests such as proBNP and troponin can be used for prognostication. Now, further cardiac testing is needed to determine the degree of cardiac damage and identify the etiology. For example, an echocardiogram is needed to assess cardiac function, which includes ejection fraction, and look for structural abnormalities such as valvular disease. Other tests such as a PET scan, cardiac MRI or CT, an ECG, and even a heart catheterization may also be needed to determine the etiology of heart failure. Now, lastly, I want to briefly discuss how to manage heart failure. First, we need to identify the etiology of the heart failure and try to reverse it. For example, coronary artery disease may require stenting or bypass graft. Valvular heart disease may require surgery or transcatheter interventions. Arrhythmias such as atrial flutter may require an ablation. And finally, patients with specific disease such as amyloidosis may benefit from specific drugs that target the disease process. Now, if heart failure becomes chronic, a comprehensive approach is needed to improve patient symptoms and heart function, eventually leading to reduction of heart failure hospitalizations and ultimately decreasing mortality. Now, first, adherence to healthy lifestyle choices is important, actually very important. And this includes significant changes to dietary habits, such as eating a low-salt, healthy diet and quitting smoking. Physical exercise is also generally recommended. Now, second, guideline-directed medical therapy is a cornerstone of heart failure treatment that cannot be emphasized enough. Certain medications are prescribed according to the patient's ejection fraction and heart failure stage, as well as the patient's tolerance to medications. For patients with reduced ejection fraction, there are 4 pillars of treatment. And these include beta blockers, ACE inhibitors or ARBs, and their cousin neprilysin inhibitors, aldosterone antagonists, and last but not least, SGLT2 inhibitor drugs, which have been shown to benefit even patients without diabetes and those with preserved ejection fraction. Now, other medications such as diuretics, ivabradine, and digoxin are tailored to patient needs and volume status. Third, Patients with heart failure may benefit from device therapy, such as cardiac resynchronization therapy if they meet certain criteria, or cardiac contractility modulation therapy. Patients with heart failure are also susceptible to sudden cardiac death due to dangerous ventricular tachyarrhythmias, which are life-threatening. And these patients may be candidates for primary prevention defibrillator implantation if their ejection fraction less than 35%, or for secondary prevention if they have documented ventricular arrhythmias. And finally, end-stage heart failure may require advanced therapies with inotropes, left ventricular assist devices, or a heart transplant. And for the fun of it, I'm not sure if you guys have been following the news, but a few weeks ago, we did the first successful pig heart transplantation to a human. So please remember, heart failure is a complex disease, and I would certainly recommend that you refer patients to a cardiologist or heart failure specialist. At the end, I would like to thank you very much for listening. I hope I was able to summarize this complex disease in a simple manner that helps you the next time you see someone with heart failure.